Hello and welcome to the Bpositive Bloodstream, a podcast providing insights, stories and experiences from and for all those affected by acute leukemia and beyond. My name is Jonjo and I'm the founder of Bpositive and the host of the Bloodstream. I want these podcasts to provide help, inspiration and belief to all people. Bpositive is both my blood group and my adopted mantra that I held throughout my treatment. I hope you enjoy our interviews, and if you wish to get in touch with us, then please do so by emailing us at info@bpositive.org.uk, or you can find us on Twitter at b_positive_org. Hello everyone. What I wanted to talk about today was the importance of taking care of your mind as well as your body throughout treatment for leukemia or indeed any cancer. I think a lot of the topics we discuss here can apply across a lot of different illnesses and a lot of different situations, because people can take things from them and take a lot of learnings and apply it to their own situation. But I find it quite refreshing actually that nowadays the stigma's gone. People are far more encouraged to speak up and talk about how they feel. The it's okay to not be okay thing is absolutely correct, and there's so many other great charities doing such great stuff for mental health. It's really breaking the taboo. I mean, we're speaking up about all kinds of things. I mean across various different industries and across various different situations. But listen, I'm someone who advocates in being open and being honest. It's naturally how I am. But I certainly just felt that mental health is taking such a prominence in society nowadays, more so than it ever did before. It's you know, we want to encourage a world where we can be honest and share and actually say if we're not okay. I think this side of things is we're sometimes at risk of being forgotten, particularly for those being treated for cancer. Now listen, drawing on my own experience, due to how I presented myself at diagnosis, I didn't have a great deal of time to reflect. I was in an accelerated phase of the illness, so I really felt that I was about to start treatment straight away. I was about to join that conveyor belt of a 2-year treatment plan, so I didn't have time to ponder or even deeply consider what I was about to embark on. I'm often asked what advice I would give to those going through a similar treatment to what I did. I give various talks and seminars and things to various people, professionals or people affected by cancer and the like, but I always say the same thing. I always say to ensure that you're not bottling up any feelings, because that's a bad thing. If you fill a bucket up with water, it's going to overfill. If you fill a balloon up with water, it's going to burst. We need to let those out in pockets. Laugh when you can throughout treatment. There will be times when you can laugh. There are funny stories. Life doesn't stop. It doesn't stand still necessarily. There's still humorous things going on around you. So laugh when you can, but cry when you need, and be yourself throughout your whole treatment. For yourself, first and foremost, and for your own mental health and for your own well-being. Listen, this worked for me. I think by being open and being honest, I found it quite cathartic to express my feelings. And I really want to encourage that to anyone listening to this who may be going through treatment. I think it's really important. Now, the good thing is, and the good news, this is getting an extra push through society as a whole, as I've said, because we're all talking about being open. And there's various health and wellbeing schemes going on for all different offices and various things. I mean, you can tap into that world. There's apps for it. Mindfulness and well-being and meditation, all these things can really help. So yeah, that's just what I wanted to discuss. I often sit and think, well, what should I discuss? What do I feel could be relevant for people? And when I haven't necessarily got someone sat opposite me who I'm interviewing or talking to, I like to find topics that I feel will work well. And I think having the importance of taking care of your mind is equal to that of your body. I think if your mind's not healthy, then your body will react to that and it can work against you. So I think the more positive your mind is throughout treatment or in life, then I think naturally your body will respond to that. So listen, I was the first person, when I was having treatment for chemotherapy, I was the first person on Laurel 3, the ward in Worcester Royal Hospital, to be referred to a counsellor. I mean, I was staggered. There wasn't any kind of counselling service for a cancer ward. I mean, the nurses clearly recognised I was having some big dips in my mood. I did feel I was putting on an act sometimes, particularly for my family and friends when they would visit. I didn't want them to see me upset. I didn't want to waste that valuable time they came to visit by moping. Look, it wasn't always easy. I do wear my heart on my sleeve, and as someone who bears his soul and his personality like that, I did let my guard down on quite a few number of occasions. I guess I just didn't want to. The time's valuable, and when you get short visiting slots, I felt I wanted to make the most of that. But listen, the reality of the situation I was in meant sometimes that guard would fall and there'd be floods of tears. But again, that wasn't a bad thing. As I said earlier, getting it out, I always felt better after a good cry, and there were times when I really needed to get it out. So that was something I found was very cathartic. So listen, I was keen for any psychological help that I feel could help me through my treatment. You're stuck in an isolated room for 24 hours a day, and aside from evening visits from friends and family, and the occasional visits from the nurses throughout the day, and the odd doctor visit comes around for 5 minutes in the morning, you're pretty much left to your own thoughts, books, televisions. Sometimes this can become particularly tough. And I would get caught out with my feelings at times, and I would have overwhelming moments of sadness, and it would catch me unaware. Actually, it wasn't that I was always bottling it up. Sometimes I wasn't. I just wasn't sure. I wasn't even aware it was there. I remember at one point my sister departed at one point, and we just hugged and said goodbye. And for some reason, I just felt a wave of sadness come over me. Like reality had hit. Oh, I'm saying goodbye, but actually I'm still stuck here, and I'm here because I'm trying not to die, and I'm being treated for cancer. All these things come over you, and it can really capsize you emotionally, and I certainly felt that way. I felt that I could probably be more open to the nurses rather than my family and friends. I don't know if any of you guys listening can relate to that. Sometimes speaking to a stranger is easier, not because there's any judging, not because I think because you're not sparing any feelings. I didn't feel I had to try and stay upbeat for them. I think I was probably more myself with them because I could let that guard down and just tell them exactly how I was, and I could moan at them, and I could, and they would spend time listening, nurses and professionals. So as I say, they soon got to know me and referred to me. They referred some counselling to me. I remember the moment these counsellors walked in. Well, certainly the people who were going to put me on the path for counselling. 2 counsellors came into my room, and 2 ladies in black suits, looked very official, looked very corporate, frightened the life out of me. 100% I was shocked. Listen, I was fragile emotionally, 23 years old. Anything that reminded me of the severity of my illness did that. I just think I was fragile emotionally. It didn't take a lot to rock me. I actually recognised one of the girls because she was a year or so below me at school. And she didn't actually recognise me, and I just remembered her face. I wouldn't have known her name, but I don't know, these things sort of broke me, and I just felt this is so official and so corporate. I just want someone to talk to, So within moments of them walking into the room, I think I was in tears because I was just welling up. It was something different. It was reminding me again of the severity of my illness. But listen, they referred me to a very nice lady who's from Kidderminster, and she was great, and she was a similar age, maybe a bit older than my mum. She had that sort of warm, friendly feeling about her, and she was great, and she would come and listen. And those weekly sessions they did help. I could relay stuff to her. She wasn't allowed to talk about anything specific to my illness. She's not a medical professional, so she couldn't relay any information about that or tell me how well I was doing, but she could see I was, I think I just chewed her ear off, as you can probably imagine, for about the first hour. But she said it was great that I did that, because sometimes when you talk to patients, counselling, or however you want to describe it, it's hard to get the feelings out of them. Well, it wasn't for me, because I kind of threw them all at her, and I offloaded it, and I felt better, and I threw it all at her, and I was kind of thinking, right, what next? This is me. And we got a lot out of it, and we had a series of sessions before I headed over to Birmingham for my transplant, where I think there's about every week, and she would come and we'd just check on progress. But just by having that kind of routine, I think routine's important throughout cancer treatment. I felt that it was positive, and that it was something that was working well for us. Each and every day wasn't doom and gloom, despite the situation. It can sound, people often find it surprising when I say that, and people find it hard to comprehend. Oh, but you've got cancer, how did you deal with it? Well, you do just deal with it, okay? You have to. There's no getting out of it. There's no quick way out of it. And it does become a reality. When the world becomes, when that world of being affected by cancer becomes your reality, your day-to-day, you do react to it and you do start dealing with it. But it was important to me to feel like I was in control of my own situation. And I would be informed by everything I was taking, the purpose of every injection, the drug, what it meant, what it would do to me, how I would feel afterwards. When I felt I had that semblance of control, and I know I've spoke about that in previous podcasts, but by having that control, I felt I was in a better mental state to face things and to overcome them. And there was loads of times I was having to overcome mental hurdles. Little subtle things would catch me out and throw me off completely, and could honestly send me spiralling and into overwhelming feelings of sadness. It wouldn't take a lot. So if you experience that, it's not unusual at all. We're getting through the day, I would be having jokes with the doctors and nurses, and then I could be sat there on my own and I could just become upset. I spoke before in a previous podcast where I'd been home for the weekend. I was saying to my auntie had popped around with my cousin, and when I was saying goodbye, I felt particularly upset because it was a reminder that they come to see me because I'm actually really not well and I'm just about to go back to hospital. I've been putting on a brave face of it. Mentally I was struggling, as much as the drugs were doing great for me, absolute wonders. I was smashing them down, I was responding really well to treatment. I was struggling with things, and that was noticed by all. At Worcester they asked me if they thought I was depressed. I maintain that I wasn't, and I don't think I was at all. I got up each and every day with some purpose, whether that was just to brush your teeth or to I had to get up because I had to empty the bottle that I was going to the toilet in, but because having to monitor everything that passed in and went out of me, so I had to get up. But I certainly, you have to get up and have your bed made and things, and I was always trying to surface and smile. There wasn't too many days when I was absolutely not wanting to get up because of my mental state. I think the doctors and nurses certainly the nurses are particularly wonderful at that, and got heaps of praise for them for the way they can pick you up when you're down. And nurses plenty of time stayed after their shifts to hear me out and to hear me cry. One nurse at Worcester called Tuni was particularly memorable for that, and she gave her time and she stayed late, and she'd finished it must have been nearly an hour before, and she was just sat listening to me, and she identified with me being upset. It's I've got so much time for the people who do that job, because without them I honestly don't think as many people would be able to get through the illness. I certainly feel I was able to get through my illness better because I was kept positive and stayed positive and kept in a mental state which enabled me to grab that control and to be able to walk forwards and face each day. Not everyone can do that, but I think by sharing your feelings and being open, I think it can help. I'm absolutely adamant it can help. So I told the guys I didn't think I was depressed. I did suffer some very low times. I was 23, the youngest on the ward by a mile, and I've been told I was days away from death only a few weeks earlier, and that I had cancer. It was a really, it was a different world. Your life's thrown upside down. That's enough to throw anyone's mood. I did struggle, of course I did, but I felt I wasn't depressed. I could still raise a smile when I saw my family and close friends. I still had interest in following my football team. Against my better judgment, we didn't win many games when I was during treatment, but I had something I could put my focus to. I could place my mind elsewhere at times, which I don't really think I could have done if I was actually depressed. So I said I didn't think I was, but they could see that I could benefit from chatting to a counsellor. So I absolutely snapped that up. I think the better I felt I was doing with my treatment, the better I dealt with things. I felt positive feeling. It becomes your focus. It becomes your project almost. It's certainly. I remember my dad describing my illness as a project for the doctor. They don't want to get this wrong. It's their project, so it's as important to them. It's their day to day, and I kind of took that on myself. I had my treatment path lined up for the next 2 years. I was taking it step by step. If I had when I was in isolation, I was looking at the injection I'd be having. I was looking at the treatment, the chemotherapy I'd be having. And my goal was to, as I spoke before about breaking things down in milestones, it was to get through the chemo. Then it was to get over the rest period and then get into the transplant and then have the transplant and then recover and then, give yourself a milestone. Again, it's about having that control, having people I can talk to, I can speak openly to. All that keeps your mental state more positive and keeps your spirits up and kept enabling me to stay focused and actually feel like I was pushing forwards. Now listen, I'm not suggesting that there's an easy way out, because if people are struggling with their treatment, then that's going to impact on their psychological state of mind. It certainly did with me. I had complications, I had hurdles in the road. I was getting blood clots that meant they had to reconfigure all my treatment. They were looking for a bone marrow transplant potential to be a donor. There's all these things that were changing the course of action and perhaps interfering with the treatment. Everyone has hurdles. I suppose I'm only ever speaking on what I felt worked for me, and certainly what I feel can work for other people affected by cancer and obviously leukemia specifically, because that's what I know. But I've chatted to many people affected by different illnesses, and I've joined steering groups and working groups and writing sessions and various other groups, and by sharing, I think it helps when people can identify. You can always, I think what I found with chatting to a stranger is that, again, I didn't have to put on an act to pretend things were different to what they were. It's all about being transparent, and as I felt I was doing well with my treatment, I would get that information relayed back. I felt I could be more open about things, and I felt like I could, I wasn't necessarily crying as much, because I felt, actually things are going well here, which is a bizarre world when you're dealing with cancer. But again, your body, your mind, it reacts to the situation you're in. The human mind's an incredible tool, and I think when you can work it in your favour and when you can grab control of it, I really think that helps. In all honesty, I felt I was most in need of psychological support after my treatment. Now, again, that comes as a shock to some people, because they assume that when you've been given diagnoses, you must go into an absolute spin and you must not know what to do with yourself. You kind of do, but I had to move quick because I got put on this conveyor belt of treatment, as I mentioned earlier, so I didn't have too much time to dwell or ponder. I had all the time in the world after I was recovering from my transplant. I was bedridden, I was having afternoon naps, I was tremendously fatigued, having undergone highly intensive chemotherapy that led to your transplant and 18 months of treatment. You're still recovering. It takes its toll. I had months and months of day-to-day care when I was in Worcester and Birmingham. Day-to-day, people checking in, people managing your bloods, managing your medication. Everything was done for you. And yet when I came out of my transplant, I felt like I was left on my own throughout recovery. I felt like I was sort of spat out of that system. That's where I wanted to be. I wanted to be out of hospital. I was praying to God that I would get out of hospital. Then when I was there, I found it tough, because I didn't know how to be amongst myself. I felt my temper was getting shorter. I needed to offload. I needed to speak to people. I needed to share how I felt, and I didn't realise I did until that opportunity came. I think it perhaps feels more isolated out of treatment and back in the real world than you do in hospital, and I just think that's because it is a battle with your mind. Then I'm nervous about things. I haven't got the reassurance that you've had. I'm worrying about coughing and outside. I'm worrying about people around me. I haven't got the reassurance. You've got phone numbers you can get in contact with, but when you're in hospital, you don't have to. You don't have to do that. These struggles obviously led to me, as I say, feeling that I could do with sharing and discussing my feelings. Now, I'm someone who's open to that. I'd really urge people who aren't to try and to talk to anyone who's available. You can speak to the clinical nurse specialist who'll put you in touch. When I got to Birmingham, everyone kept talking about a lady called Anne. And Anne Bond, her name was. She's honestly my shining light throughout my whole treatment. Of course, my family and were absolutely amazing for me and my close friends. But Anne Bond is someone I will always just have the most amount of love for. She was she probably still is, but she's a psychotherapist, at Birmingham Queen Elizabeth Hospital. She's a former GP, and she's the nicest woman you'll ever meet. She's like the grandma you'd always want. She's your nan. She's someone you would love to talk to. She was just so accommodating, but she understood. She actually used to be a GP, so she lost her central vision in her eyes, and that led to her having to take a real curve from her career, and she got into counselling and psychotherapy. And what I had when I was recovering from my transplant, I would have to go there a couple of times a week and a few times a week, and then that would go into once a week and then once a month and whatnot. And every time I went, your clinic days for your post-transplant are on a Wednesday at Birmingham. So it'd always be a Wednesday I'd have an appointment. And once I got over the nerves of waiting for my blood results and to see how well I was doing, and thank God they were saying, listen, that you're responding well to the transplant, things are going well. So that's how things were starting. But from the off, they told me, listen, you should chat to Anne Bond. And I chatted to her during my transplant, briefly. She introduced herself and said, listen, when you're out of the transplant, we'll connect and we'll chat. And, you know, what I think's great about the Trust at Birmingham, Queen Elizabeth, powered by Cure Leukemia, I believe, or funded by, their clinic room is such a lovely space. They thought about the art on the wall, the colour of the wallpaper. Everything's been considered to make it a more relaxing environment. That helps you mentally. That absolutely helps you psychologically pass through your treatment. And I had an office there, and it was sofas and whatnot, a nice comfy room. And she understood. She could identify with everything I was saying. Nothing I was saying was wrong. She didn't contest anything. She just listened and listened and listened. And she made me feel 10 foot tall. What she'd say in a few words, I probably couldn't do in 1,000. I mean, I am a rambler, but she was so succinct and just so great, and she just understood me, and she talked to me like a person. She was unbelievable. She was absolutely valuable to me. I can't do it justice enough. But she empowered me to sort of open up without any persuasion. She just has that aura about her that you want to open up. And I remember my mum said when I'd come back from those clinic sessions on a Wednesday, I'd be 10 foot tall. It would make my week, and I couldn't wait to get back and see it. I would just feel good about myself, and I'd feel like she would remind me that, listen, you're putting this behind you now. You're here, you're sat here. We've got to look forward. I think I craved, not the attention, but I craved something from the world that I was leaving behind. You know, I don't want to. You're praying to God that you don't see doctors and nurses in hospitals. But when you just spat out, it caught me unaware, and I would struggle emotionally. But once a week I could go back and tell Anne about it, and she would say, it's fine, it's normal. This is what happens, people go through it. And because it was normal, because other people were going through similar difficulties, or I mean, she wouldn't speak in specifics, but she would certainly say her experiences told her that everything I'm experiencing is perfectly normal. That meant so much to me, and it meant I could resonate with that. So it was something that I absolutely felt was crucial to my personal development and helped me get through my transplant and all my treatment for leukemia far more effectively, because my mind was more stable and in a better place because of the support I was receiving. So how would I wrap this up? I mean, it's essential that we open up about how we're feeling. I would urge you to not try and bottle things up and to speak openly and honestly about how you're feeling. It is okay to not be okay, especially when you've got bloody cancer. Of course it is. You know, take advantage of all the psychological care that's available, both during cancer treatment as well as after. I actually feel the post-cancer treatment, the post-cancer care is not an untapped market, but it's certainly, I think it's lacking more. I think people focus on patients when they're in, but when they're an outpatient or when they're leaving the world behind, I think psychologically it's lacking, and people probably find themselves in the place I did, really struggling. How do I pick my life up? How do I get back into work? How do I do? All these things need to be catered for, and that was me without kids or a mortgage or any kind of responsibilities. I was living at home with my mum, and I still felt this. So God knows what people feel like when they've got to rush their life and get it back together. You know, I won't in any way compare it to coming back from a war zone or anything, but when I hear stories like that, any kind of traumatic experience will have an effect. Cancer is a traumatic experience, so it will naturally have an effect on you. So people who come out of that world absolutely need the help and support. So yeah, take advantage of all the psychological care that's available. And don't assume people who've finished treatment are fully recovered. I mean, I don't know who I'm talking to now, I'm just kind of ranting. But it is easy to say, well, do you know what, they're out of treatment now, everything must be rosy. There's a lot of battle still going on with people potentially, and the more we can encourage people to share their feelings, then the better they'll be. And you never really know what's going on with anyone behind closed doors, and but the more we can encourage people to share them, absolutely, that for me is essential. But also, we're not just talking about the patients here. Look out for someone supporting someone affected by cancer. They need support too, and they absolutely have the same difficulties. Sometimes more so. I mean, my whole family took on my diagnosis in one form or another, and they need support too. I've often described sometimes it might be easier being the patient because you get to handle the treatment, you get the day-to-day, you feel like you're in control. Everyone else has to sit and wait and watch and cross their fingers and hope you make it. You know, I watch a lot of football. Footballers don't feel nervous when they play, but the fans are absolutely in knots because they can't control it. What you can control, you feel better about. So the people supporting people affected by cancer need help. They need that support. And if anyone listening to this does know someone, a close friend or family, who may know someone who's been treated for cancer or any illness, check in on them, ask how they are. Honestly, it can help massively. It can make their week just by having someone to listen to bend their ear off, to know someone's there. I can't overstate the importance of that and how important it is. Keep talking about how you feel. Speak to others who've had some idea what it feels like. Connect with those people who you can resonate with and maybe able to resonate with you. I took as much from talk and from listening to other people as I did from sharing my own feelings. And by listening, sometimes that can make you feel 10 foot tall as well as massively help the person the other side of the table. But open up. And there's things like meditation, health and wellbeing activities. There's apps for this where you can calm. There's books you can read. I read an incredible book called The Chimp Paradox, which was fantastic. It teaches you to apply your mind in different ways. So when you have struggles or when you have various issues, you can partition it and you can control it. I won't go into too much detail about that, but certainly I'd recommend any of you to read The Chimp Paradox because it applies to us all. But I think if you're dealing with cancer, it gives you some tips on how to separate your mind from reacting to things. Now, it's not always easy when you're on various medication, but the more control you can have over your mind and the more aware you are of how you react, the better. So there's lots of things out there, but there's meditation apps. There's various, exercise I'm a huge fan of. That isn't for everyone, but listen, whether it's walking the dog, whether it's going outside, any of that can help. Going for a run, walking the dog, going to breathe some fresh air and smile when you can, okay? It's okay to feel upset, cry, let it out, let your feelings out, be open, wear that heart on the sleeve sometimes, and you'll take a lot from it. It'll really help. Our bodies take an awful lot, an absolute insane amount throughout treatment for cancer. It is absolutely essential we look after our minds as well as our body to help us get through it.